Hi, Sharon. Great to speak with you again. How are you today?
Hi, Devin. I'm really well, thank you. Yourself?
Very good. Do you want to give a quick introduction to yourself and the work we've been doing together and how it relates to the Crisis and Resilience Fund?
Absolutely, happy to do so. Good afternoon. I'm Sharon Warner, Head of Welfare Services, currently at Slough Borough Council, but formerly was Head of Welfare Services at Bracknell Forest Council, involved with policy and practice and the LIFT programme whilst at Bracknell.
Fantastic. Thanks so much, Sharon. It was great to see LIFT mentioned in the guidance for the Crisis and Resilience Fund. I guess I'd start by asking what was it that first encouraged you to bring LIFT into Bracknell Forest?
I think the advantage that LIFT gave us over the data sets that we had was enabling us to make a clear and consistent story and a narrative for elected members and senior leaders throughout the organisation that up to that point we hadn't been able to do. So utilising LIFT and the data sets, that it enables you to provide a heat map. It enables you to have a one and done approach to prevention and hardship, which we just weren't managing to sell to our leaders in the way that we were able to with the programme. So once we saw what the capability was, it was a no-brainer to bring it into Bracknell.
So it's making the data you already had much easier to use for things like the Household Support Fund at the time and the Crisis and Resilience Fund in the future. What's the one piece of advice you'd give now that you've seen the guidance for the Crisis and Resilience Fund for those that already have LIFT? What's the one piece of advice you'd give them on how to make the most of that data?
I think the biggest piece of advice is to think outside the box and to look at what LIFT can offer you. Perhaps you haven't considered maybe targeting a cohort that was just too difficult to identify. So whilst at Bracknell Forest, for example, we identified a cohort that were living in fuel poverty. That isn't something that a professional in housing benefit or local welfare provision would necessarily have access to that information. What this enabled us to do was to take a really preventative approach to an unmet need for a cohort we didn't know.
To identify those, in that case, those that were in fuel poverty, as well as, and I think it also mentioned housing support in the case study that was in the CRF guidance. How easy was it for you to get that, I guess, that cross-departmental buy-in, so using it across revenues and benefits and housing? And what advice would you give to those that are considering how they can use that data in other areas?
I think the clear narrative that LIFT enables you to make makes it very difficult for people to say no when you're trying to work with them around maybe maximizing income or reducing outgoings. So what we found was there was no such thing as a closed door. Everybody was really keen to learn. So when we showed housing what the engine could do and that we could target, say, discretionary housing payments at a particular cohort, therefore preventing homelessness, there was no difficult conversation. The buy-in was, well, what do you need from us and how can we utilize it?
That's incredible and really refreshing to hear. Having worked with a lot of different local authorities, I think one of the things I've noticed is sometimes sits within specific teams, because I think the guidance around income maximization, helping residents to boost their incomes, I think translating that into direct savings to the council can be sometimes difficult to articulate. You're obviously someone who believes in that. Would you mind having a go at articulating how helping residents financially helps the council?
Yeah, I mean, there are infinite ways, and I would say this is kind of our day-to-day business now. We've shifted away perhaps from revenues and benefits, which was our bread and butter, into more of a welfare and preventative side moving forward. But just thinking about bringing in, firstly, additional revenue to the council. So, for example, we've used the LIFT programme to run an attendance allowance take-up campaign for our over 75-year-old residents. What that gives is money into their pocket, but it also has helped us to deliver additional income through care fees. So that's been a win for residents and a win for the council. It's also enabled us to minimise our households with debt, living with priority debts such as council tax. With the changes that have been made as a result of council tax support and localisation, we saw more and more people starting to live with low-level arrears, gathering over time, sometimes ending up in the many thousands. People being able to manage a little bit easier because we've got them an additional benefit, or we've reduced their outgoings in some way, or we've targeted an intervention such as the household support fund, enables people to just manage that shortfall in a more sustainable way, not lurching from crisis to crisis. And what it has also built is a feeling of trust with the council. So people come to us now at the earlier points. They're not waiting until they can't pay their council tax. They're coming to us at the point where they might need help so that we can build sustainable options for them and maintain their resilience, i.e. crisis and resilience.
Yeah. So, and it sounds like you weren't just using it for the Crisis and Resilience Fund. I think it sounds like it was very easily adopted to a whole range of other use cases across the council. Is there any other advice you'd give to councils considering using their data in a more proactive, preventative way to get that buy-in? You're obviously considering it at Slough as well. And is there anything you've seen about how LIFT's developed over the years that particularly excites you about the potential to be more proactive and preventative in the future?
Yeah, so we've just considering it here at Slough, and we're working very closely with our public health team, because what we realise is that what LIFT enables us to do is identify cohorts that are also in scope for public health grant funding, for example. Whilst at Bracknell, we utilised LIFT data to drive a take-up of free school meals. We utilised LIFT as the take-up for a pension credit campaign, which then brought with it at the time the winter fuel payment. So additional income coming to households that we could support with. But here at Slough, yeah, we're looking at public health, looking at maximising the Warm Homes grant and utilising this information and this data to target that intervention at a cohort we know are in need and maybe less able to come to us than us go to them.
That sounds so exciting. And I've heard you talk about these other campaigns, so attendance allowance, pension credit, free school meals, Warm Homes grant. Is there anything you'd say about the resources required to help to actually engage those residents? So LIFT identifies those households for you. Was it ever a challenge for you to then use that data to get those households to engage?
It wasn't a challenge because I was passionate about this from the outset, and therefore I was able to persuade and cajole my leaders to support the work of the service. But we do recognise this is a non-statutory function, and therefore there are times when you have to have difficult conversation about resourcing. This was a no-brainer. If you believe in prevention, if you believe in assisting residents to sustain improvements, to be resilient, to build a community that we all want, then the resourcing comes with it. What we are seeing is that this is a shift away from traditional revs and bends posts as housing benefit diminishes, and we're looking at what does that mean for councils as a whole. We haven't seen a significant reduction in caseload what we anticipated, but actually we're pivoting. So staff are now considering all of a resident's circumstances rather than just thinking about housing benefit or council tax support. They're best placed to do that. They know what they're doing. They can help with benefits, and they're getting really sustainable options for residents moving forwards.
And finally, just thinking about the title, Crisis and Resilience, what is the final thought you give to councils who are thinking about, this is here to prevent crisis, but I also need to use those limited resources to then move into prevention. It's asking me to do quite a lot. How would you encourage councils to make the most of the support that's been made available to them through the CRF?
I think the biggest takeaway I've got from the guidance is that we need to be working in partnership. So we don't know best. So listening to the needs of our community, taking advantage of all of the options that are out there, all of the data, all of the software. Let's maximise this to make sure that this fund isn't just 3 years, but this is something that builds our community's resilience for the next 20. That's my aim, medium term, long term. I don't want people to come to me in crisis. I don't want them to need to. I want them to be able to know straight away there's no wrong front door, and we're going to use all of the data and all of the technology that we've got to get them where we want them to be.
Well, it's been incredible, Sharon, to hear about your passion for using data to proactively prevent people from getting into crisis, help boost their incomes, a little bit about how that income has helped drive savings for the council as well. And again, that ability to reach outside of traditional revenues and benefits, where I think these services have sat, to how they can make a difference across not just the council, but across residents and across partners in the community and voluntary sector as well. So I just want to say huge thanks for your time. I've really enjoyed working with you and also speaking with you today. Thanks, Sharon.
Thanks so much.